So I'll just be discussing how to design a healthy space and what technologies will be used moving forward. First, we need to determine what the exact issues are. So from my perspective, there's really three main things you need to address. The first is the fundamental basis of indoor air quality for general health and to make sure people are comfortable. Then we have to tackle fine particulate matter, outdoor air pollution. We saw it with wildfire smoke this summer. Smog and pollution are leading killers. So that needs to be addressed as well. It hasn't been adequately addressed until now. And the third big problem we have is airborne diseases. So if we address all of those, we've really done a good job at creating low-risk spaces. So the first technology which we need everywhere is ventilation. It's supplying outdoor air to the space. This is what's required in building codes. Step one is to make sure you're complying with what's in the building code. There is evidence that increasing ventilation rates beyond the minimum required does have health benefits and comfort benefits. There's an issue with ventilation. One, you're bringing in outdoor air pollutants. So it is better. Usually indoor air is much worse than outdoor air. So it helps, but if there is lots of outdoor air pollution, then there's other technologies that could be better. Ventilation is also the most cost intensive when it comes to energy and creation of greenhouse gases. So you want your fundamental base of clean air from ventilation, and then look at other technologies to clean the air further. And ventilation should be confirmed with CO2. You can verify that you're getting the adequate amount of ventilation from carbon dioxide monitoring. That should be something that everyone uses moving forward. The next step, this is low-hanging fruit and really needs to be done everywhere, is MERV 13 filters. Just like, surgical masks, I don't see a huge use. Lower rated filters are just, we have better filters to actually protect people from airborne hazards. It's low-hanging fruit, and that's what really needs to be the standard moving forward everywhere, both to protect against outdoor pollution and also you clean recirculated air from any airborne pathogens. So once we have addressed ensuring adequate ventilation in the space and upgrading the filtration to MERV 13, and those are always the fundamental basis, at that point, we need to introduce additional air cleaning in order to control infectious aerosols. We now have a standard on how to do that. So what you do is you find out how much air cleaning you're currently providing, find out how much is needed, and then you have to make up the difference. So we have lots of different options on how to do it. I'm listing the main ones here. I'll go through them. So one is just increasing the ventilation rates further. Again, that has a very high energy cost to it. So it's not always the best long-term solution if you want to take sustainability into account. The next is in-room air cleaners. I will speak about it in a little more detail. HEPA filters, Corsi-Rosenthal boxes, or ones with UV. There's other ways to use UV. One is putting it inside ducts. The issue with putting it inside ducts is if you're already having MERV 13 filtration, there's going to be diminishing returns because the recirculated air has already been cleaned pretty well. So in general, if you're using MERV 13, I would not recommend using in-duct UV. Then there's a few different ways to use UV inside the room. One is upper room UV, far UV, and what's called the Dibel system. I'm sure a lot of people haven't heard about that. If you want to learn something new, I'll tell you about the Dibel system. I'll go into those in more detail. And the last thing I'll just say now, electronic air cleaners like ionizers and photocatalytic oxidation. I have not seen any evidence that they are safe and cost effective at the same time compared to the other technologies. So they're not really for consideration currently. Okay, so in-room air cleaners, this is one of the main things that people have done. It's low cost and it's easy to implement everywhere. They have their disadvantages. One, when you're sticking a fan in a room, it makes noise and it's hard to get very high clean air delivery rates when you have a fan in a room. So this has always been a challenge with these cleaners. Now they have ones with PC fans, which are ultra quiet. They're really nice. That's what I use. But it's not always the best long-term solution, especially in public spaces. These things often require human operation as well. I'm sure we've all seen them off everywhere. If people don't care, which happens in a lot of places, they do nothing. So these are an effective tool. They can work. They're easy to implement. But because of the human operation aspect and the difficulty to get extremely high clean air delivery rates, they're not necessarily the best long-term solution. Upper room UV is really a technology that I think needs to be considered much more moving forward. How it works is you divide the room into two parts. There's the lower room where everyone is, and then there's the upper room above everyone's head. That's the disinfection zone. So you have UV fixtures that shine light into the upper room, and you reduce the exposure to people below. You could get extremely high clean air delivery rates, 20 to 30 air changes per hour. Before the pandemic, this was used primarily for TB control, and we have evidence from measles, TB, influenza, and with COVID that this is a very effective tool and can be used a lot more moving forward. Another technology that really became much more well-known throughout the pandemic is called far UV. So the difference between far UV and upper room UV uses 254 nanometer wavelength of UV light. Far UV is in a spectrum of lower wavelengths. The most common ones are 222 nanometers. Far UV, your skin can take a much higher dose of far UV light without it actually hurting you. So because of that, you could actually shine far UV lights into a room and expose people to it, and at a pretty high dose, and it's not going to hurt your skin or your eyes. In the picture here, you could see Dr. Ashish Jha, and behind him, there's two far UV lights shining. And in the right side of the room, there's an upper room UV fixture. With far UV right now, there is evidence that there's concerns about ozone generation. Upper room UV, I think, is much more ready to be deployed. Far UV, I think we need better evidence on what power we should have in order to make sure that when it's used, it's safe and effective. ASHRAE 241 has guidelines about how to do that. So once we need better data on how to comply with that. The dival system, which a lot of people probably have never heard, it's called direct irradiation below exposure limits. This is what far UV is essentially. You're just using UV LEDs that are at a longer wavelength, so they have more potential to hurt you, but you just use it at a much lower power. There's a much lower radiance. You just keep it below what's the accepted exposure limit. You could shine it into a room. So you're not going to get as high intensity as you would from far UV, but it still could be effective, and there's lower concerns about photochemistry, and it's probably easier to install. These are just LEDs as opposed to the krypton chloride excimer lamps with far UV. This is not a really well-known method. I don't think it's been used anywhere, but it is a theoretical thing that can be looked at in the future. So just to summarize everything I've gone through, first, ensure the ventilation requirements are met based on the indoor air quality standard. Confirm that with carbon dioxide monitoring, upgrade the filtration and air handling units to MERV 13. And then you should try to comply with ASHRAE 241, the cleaner delivery rates. You could either increase ventilation, use in-room air cleaners, or various UV technologies, upper room UV or far UV, or even possibly the dival system. So that's everything from me. Thank you.